Great. Okay, cool. All right. Well, out of respect for people's time, we'll start now. Hopefully end on time as well. So I'm Chris Mooney. I'm from the University of Rochester School of Medicine and Dentistry in Rochester, New York. Beautiful time of year here in the Northeast Great Lakes area. I'm an associate professor here at the university, and I have roles in assessment and roles in education research. I'm also the current director of the Society of Directors of Research in Medical Education. And the aim of that organization is to advance the quality of medical education through research and scholarship. So it's fitting for me to be talking to all of you today about ways to develop meaningful education scholarship. Should I advance this here? Okay. All right. So for those who are clinicians in the audience, there is CME available. I believe it's like 1 credit for attending the session. So do what you will with this information. I'm kind of unfamiliar with the whole CME world, but it exists. So just to kind of situate the session, the people here for the first time, this is part of an ongoing faculty development series that's geared towards clinician educators, as well as just educators in general, trainees, and it's really based on the guidebook for clerkship directors. Prior sessions, series 101 and 201, the webinars are available on the Alliance for Clinical Education website. Today's session is not the last which I just learned from Dr. Beck Dallahan. In fact, there's another one that's coming down like in the future around lifelong leadership. But still kind of fitting toward the end of these as we're talking about scholarship and lifelong learning. A lot of what I'm going to be talking about today can be found in, as we said, the guidebook for clerkship directors in chapter 23. There's no way I can go into everything about this topic in today's session. The chapter goes into much greater depth. We are revising it. I encourage you to check it out if you can. Also, I'm the only one presenting today, but I do want to take a moment just to acknowledge my co-authors, Dr. Ann Nofziger and Sarah Payray, who are two incredible educators and thinkers who contributed significantly to this work. All right, so this is what I'm hoping that we're going to cover. Walk through a bit about what we mean by education scholarship and what qualifies as education scholarship and how it's distinct from just doing research. We'll talk about common barriers that can get in the way of successful education scholarship. There are a host of challenges, right? Time and resources being the obvious, but I want to focus today on reasons that scholarship fails because of issues in the conceptualization and dissemination phases. There's good news too. We'll also explore some strategies for developing high quality education scholarship. And I put together some tips that I think are high yield, some perhaps more obvious than others, to help you consider as you're developing education scholarship. By the end of it, I'm hoping you'll feel a bit more confident and better equipped to engage in the scholarship process. I'll also just say too, there are people here today who are quite familiar with education scholarship, so please feel free to contribute to this discussion, to disagree with me, and offer your expertise as well. Okay, so we're going to start here. What's education scholarship? It's a term we hear often. Sometimes pinning down a clear definition can be tricky, and it kind of reminds me of that famous moment in Supreme Court history where one of the justices was asked to define obscenity or so, right? And the response was essentially, I knew it when I see it, right? Really kind of captured that idea that some things are hard to define, but we kind of recognize it when we come across it. And I think scholarship, especially in education, works similarly. It's not just about publishing papers, presenting at conferences. That's certainly a big part of it. Scholarship is an integral part of academic medicine and academia. It shapes how we operate as individuals, how programs operate, how institutions operate. And it goes without saying that it plays a key role in career advancement decisions, right? In many ways, it's the coin of the realm in that regard. So if we're aiming to produce scholarship, we have to dig a little deeper. We have to really think about what it entails. We'll start here. So this is probably not news to anyone, but traditionally academia, right, it's placed a strong emphasis on research that generates new knowledge, right? So the classic image of scholarship involves someone who's conducting experiments, collecting data, and pushing intellectual boundaries, the boundaries of what we know. Over time, our understanding of scholarship has evolved, right? And that's largely thanks to Ernest Boyer, who helped to really kind of broaden the definition of scholarship and proposed that, in fact, there are 4 key types that are shown here: discovery, integration, teaching, and application. And just to real quick overview of these, scholarship of discovery, right? That is what I mentioned, is traditionally aligned or is that which is kind of traditional research. Integration is work that synthesizes, that it's interpreting, it's connecting ideas across different disciplines. So you might think a little bit about meta-analyses, or think about certain types of reviews that are very kind of prevalent in education scholarship now, right? Systematic reviews, scoping reviews. We have the scholarship of application, which takes findings and uses them to tackle real world problems, right? So those problems might be, or we might think about this as being kind of translational, right? Really bridging theory to practice. And then finally, the scholarship of teaching, which uses a scholarly approach and best practices to enhance learning in new ways and improve outcomes. I like this graphic from an academic medicine last page. It does a great job of breaking down the 4 types of scholarship and giving examples of what a scholarly approach looks like in each type. I encourage you to check it out. This appeared in academic medicine in 2021. I don't want to get in the weeds differentiating among them any more than I already have. But take a look at that. Instead, I want us to focus or think about scholarship in a bit more kind of simpler way, right? Boyer's categories, those 4 categories, provide a helpful framework, especially for academic promotion purposes. But I wanted to think about it in a bit more kind of straightforward way and think about it using a definition that Cleland and colleagues developed, a clear, concise definition, which appeared in this Amy guide. And so they define scholarship as publicly disseminated activities that advance practice and knowledge for health professions education and the broader health professions education community. So again, just kind of publicly disseminated activities, right, that advance practice and knowledge, right? It's thoughtful, appropriately broad way to think about scholarship that captures what we should be aiming to do and to achieve. And I'm going to be coming back to this definition throughout the session today. So that's the one kind of nugget I want you to just kind of put into your head right now. Publicly disseminated activities that advance practice and knowledge. Regardless of those 4 types that Boyer said, or even thinking about Cleland's definition of scholarship, all scholarship should adhere to specific standards or criteria that assess quality. And one well-regarded framework for this is provided by Charles Glassick, developed in the late 90s or so, shown here, which aim to establish clear, consistent standards for assessing the quality of all types of scholarship. This is used often in education settings. It's used in social science, it's used in the humanities, where diverse forms of scholarship exist. So having clear goals, adequate preparation, appropriate methods, having results that are substantive and honest. Dissemination, there it is again, right? The dissemination piece, and then reflective critique. So pretty straightforward. When I share this framework with medical students, when I share this framework with other faculty, the common response is kind of like, yeah, duh, right? This is commonsensical, and it is, and it's not entirely helpful, right? I share this framework because I want you to be aware that it exists, right? This is when we think about education scholarship, knowing Boyer or knowing Glassick are important. This helps to form the basis of standards that journals and editorial boards and peer reviewers and promotion committees use to assess scholarship. But I get that these standards here, um, they're vague. They're not super helpful when you are actually developing scholarship. So for the remainder of the session, I want to focus on specific reasons that scholarship fails, hear your ideas about this, and consider some tips that can help to, as Cleveland says, disseminate your work so that it can advance practice and knowledge as it pertains to the health professions. So let me ask you, why does scholarship fail, right? So specifically, why do many submissions get rejected for publication, for that dissemination? Is it simply the opposite of that criteria that I just had on the screen? Clearly, there must be more, but go ahead. What do you think? Feel free to share them out loud, put them in the chat. Um, why does scholarship fail? Hey, Emily.
Hi. I mean, I can think of a handful of reasons,
Yeah.
like single institution subjects or lack of rigorous
Mhm.
methodology or no theoretical framework or.
Yeah, absolutely. So you touched on some very um, common issues that result in that process. Anyone else? I'm happy just to kind of move us along if people are shy to speak in this setting. Right, to with not an appropriate scope. Yeah, so sometimes it's an alignment issue, right? In terms of like, is this the right fit for this forum, right? Is this kind of goodness of fit test, which can be challenging to figure out. Anyone else? Gary, were you gonna say something or no? Just showing your pretty face.
Yeah, no. That's why I'm sitting back further. Um, no, I mean, one of the reasons for failure or rejection, I think, is a big one that the editors say is that you didn't follow their instructions, for one thing. But I think the other thing too is just considering the methodology and making sure that it aligns with the research question that you
Yep.
have.
So much of so that's tip number 7 I'm going to share with you today is exactly that, Gary, that reason. There's many tips that we can think about why scholarship fails. So I did a little homework, um, pulled together some of the top reasons for scholarship rejection. And this is really thinking about scholarship of kind of discovery in some ways, but it doesn't have to be kind of confined to that. So this comes from a study by Meyer and colleagues who looked at editors' feedback for rejected submissions from the journal Academic Medicine, along with some kind of just personal insights from some other medical education scholars, including Jeff Norman, a very well-known researcher and cynic. Um, so many will sound familiar. What Emily said, what Gary had said, right? So things like ineffective design, unclear goals, poor data collection, weak conclusions, choosing topics that aren't seen as important, inadequate theory and evidence, and submissions that are poorly written. Here's another study from Jorge and colleagues that was done in 2021. They surveyed peer reviewers from a leading health professions education journal, I believe over a 3-year period, and identified a number of recurring issues. This table gives some great insights for anyone looking to publish, but I highlighted a few things that I just want to draw your attention to. So unclear study goals, lack of connection or implications for the field, no compelling argument for why the study matters. So no problem gap hook, and we'll come back to that in a moment. What else? The significance of the findings is unclear. the lack of or an unclear conceptual or theoretical framework. So there's some patterns emerging here. So issues with clarity of purpose, relevance to the field, and how well the work fits into a broader body of existing work and scholarship. And so that really kind of brings us back to Glassick here in the third objective for today, which is focusing on how can we avoid those pitfalls, specifically those that relates to these three areas in the Glassick criteria: goals, preparations, and methods. And so I have 7 tips that I want to share with you to help develop meaningful education scholarship. Again, thinking about Cleland's definition, dissemination and advancing practice and knowledge, right? Because that's really what's going to comprise education scholarship. Okay, so tip number 1. So this should not be a surprise. Scholarship is not a solo sport. So it's about building relationships, collaborations to elevate your work. Yes, you may be doing the heavy lifting, but behind every successful scholar is a team. And especially early in careers, that team often includes a mentor. There is a wealth of literature on mentorship. Mentorship in academic medicine, right? Some of which Dr. Beck Delahan here has authored and shows that mentors, they play a number of different roles, right? They can be advisors, counselors, teachers, offering guidance and constructive feedback. Many of you probably have mentors in your workplace. That is great. But it's important that you find someone who can bring some, I say expertise, but not, I use that term somewhat lightly, in education and education scholarship. So someone who can guide you in research approaches, methodologies, theory, data analysis, just strategies more generally to get your work disseminated, right? Knowing where to publish, right? These are the important forums and conversations that are happening in them. Don't have someone locally, you got to find someone elsewhere. And there are a number of organizations where people will gladly serve as mentorship and have that pairing. And then, once you find that mentor, don't sit back, right? Don't expect the wisdom to just kind of flow. It's really about building relationships, being proactive, setting clear expectations. Mentoring is not a one-way street. It's a partnership that's grounded in mutual respect, shared values, open and honest communication. Okay, tip 2, ground your scholarship in reflection. This means reflecting on, I guess you can say, what personally drives you in some ways, right? And I think that's important to tap into that intrinsic motivation, which is key to staying engaged and seeing your scholarly work through. Yes, a lot of scholarship gets rejected, but a lot of scholarship also just kind of flounders and doesn't even make it to that peer review and dissemination phase, right? So really kind of finding things that inspire you, challenge you, and so on, right? So that often means reflecting on your own challenges and opportunities, right? That you routinely face when you're teaching, interacting, assessing learners. So ask yourself questions like, what's my most pressing challenge right now in my workplace? What curriculum or what curricular issue or program is not working? How can I prove a specific area of teaching, right? Or maybe it's giving narrative feedback, right? Those are all fertile areas for scholarship. And asking these types of questions will help to frame your scholarship in a way that makes it meaningful and impactful, not just for you, but for others. Which brings me to this kind of sub-tip, tip 2A or B. We often associate science with generalization, finding solutions that apply universally. But in education scholarship, it's a bit different. Instead of identifying one-size-fits-all solutions, which are probably not going to work in different settings, the goal should be to develop generalizable insights and meaningful descriptions of complex educational issues. So striking that right balance is key, right? So if we're overgeneralizing, being too broad, that can strip any intervention of any local relevance that makes them effective. On the other hand, if we have interventions that are too deeply rooted and embedded in some local context, that's going to lack broader applicability and value. So the key is to find that middle ground, right? The Goldilocks principle. That sweet spot is that your scholarship should serve as strong, adaptable problem-solving routines that are grounded in the needs of some specific setting, but informed by a broader understanding that allows for application across different contexts. So instead of trying to solve other people's problems, we have to develop scholarship that helps others think better about how they can solve their own problems in their own contexts and in the systems that they know best. All right, tip 3. I consider this to be the most important in the scholarship process. And it's a tip that was ingrained in me by one of my early mentors who always said that research and scholarship has to pass the so what test, right? So what? Why does this matter? The impact and relevance of scholarship has to be crystal clear. It has to demonstrate value to the field by addressing questions like why it matters. What specifically does this add? How will this be used? That's sometimes easier said than done. And so I want to think about a pretty popular approach that we can use strategically to help address that so what question. And so I want to do this by just looking at some work by Lorelei Lingard and Chris Watling. You may have talked a bit about some of Dr. Lingard's work before, but Dr. Lingard talks about how academic journals, they're like ongoing conversations. And every article is basically the next turn in some discussion. And I think that's an interesting metaphor, right? So if you want to jump in and be part of that discussion, you need to show that you understand what's already been said. You have to share some interests. You have to perhaps disagree in a thoughtful way, right? Bring something new to the table. And if you don't, then people are going to tune you out and walk away. And so in Lingard's view, it's all about demonstrating that you're informed in offering something fresh. And a good way to do this is to think about the problem gap hook heuristic. And so it's pretty intuitive, but I just want to go through and just show you some examples of what this looks like in scholarship. So the first thing you have to do is identify a problem, right? A challenge that exists locally, ideally nationally. Again, thinking about my generalizability tip, the balance of the local relevance and the broader national applicability. Something in the field that people are talking about, that they're interested in, that it's relevant. You then need to point out a gap in current knowledge or thinking about the problem, right? And that gap could be the lack of studies, right? A gap in scholarship. It could be some untested assumption. Maybe there's a new population that you are want to demonstrate the effectiveness of an intervention. It could be a new theoretical lens. It doesn't need to be a gaping hole, right, that you're trying to fill, because those can be hard to find in such a vast education literature. And then finally, you need to convince your audience that the gap matters, right, that it's significant, that it's of some consequence. And that's really kind of the answer to the so what question. At its core, this problem gap hook, right, it's a persuasive tool. It helps to really showcase novelty and importance of one's work. And once you're aware of this heuristic, you see it a lot, right? You'll be going through manuscripts and you see this. You'll even have peer reviewers reference it, right? As we saw earlier, one of the reasons for rejection was no problem gap hook. I had a recent manuscript that was rejected, but I did a good job establishing the problem gap hook, but there is other issues, and I'm happy to share my insights about that as well. But I just want to share a piece of scholarship just to see how this looks in practice in the wild. And specifically, look at this article from Lauren Maggio and colleagues that appeared in Academic Medicine just this past year, titled My Doctor Self and My Human Self, a qualitative study of physicians' presentation of self on social media. Yes, social media, it can be a dumpster fire and can be a dark, dangerous place, but there's also some interesting conversations that happen in these forums. So we'll just transport you to Dr. Maggio's introduction. So speaking about some of the challenge. So she's starting to set up the problem here of separating personal and professional identities on social media, and writes that maintaining the separation is not always possible in practice, as physicians and medical students note that doctors cannot be doctors all the time in digital spaces, all right? So now a bit more specifics about the problem. Specifically, the public nature of many social media platforms can make it challenging for users to control the content that's shared, who is visible. And now it starts to shift to the consequences of the problem, right? So any social media post can reach a vast audience it wasn't intended for. And obviously that can have implications, as she writes, implications on well-being, professional reputation, public perception. So starting to really put together a very persuasive narrative setting up the problem. Here's the gap, right? A little further down in the introduction, right? So if we are to develop policies and resources, we need to first understand how physicians present themselves on social media. And then finally, the hook, right? So really putting it all together, emphasizing why it matters, to provide a more holistic picture of physicians' online self-presentation and help address the need for policies and educational resources that are responsive to physicians' practice. So a really nice rhetorical structure that's stitching together all these key elements to give a clear, compelling explanation of how the work fits into that scholarly conversation, right? And why it's important. It highlights the novelty. It highlights the practical relevance. And it's really kind of making a case for why this work merits some attention. Right, and so that segues nicely into tip 4, which is articulating a clear statement of intent in your scholarship. So it means honing in even further beyond the problem gap hook by explicitly defining the purpose of your scholarly work. A common issue in the peer review process is that the goals are not always clear, right? So that makes it very challenging for reviewers to anchor or situate scholarship in any type of context. So don't make it harder for your audience, for peer reviewers, by having them piece together what it is that you're actually trying to do. So this is where it's issues of questions, right? We could have a whole session on how to design a research question or a scholarly question. But if you follow that problem gap hook framework and thought about it, right? Arriving at a statement of intent, that's my kind of broad term for all of these, shouldn't be that challenging, right? Situate it in the introduction somewhere. And it's in terms of developing it, right? The wording of it, there's a lot of different approaches that exist, each having a slightly different purpose. Some are specific to certain research approaches or paradigms, and others are just based off of stylistic preference. So one way is you can frame it as a research question, right? Our research question is X, Y, and Z, right? Do students do such and such? How do demographic factors like X, Y, and Z influence performance on NBME step 1 exams, right? Really helping to guide your reader, focus them, set the stage for investigation. Another option, hypotheses, right? Very standard in biomedical fields and quantitative research, right? So we hypothesized such and such, right? language that's really, it's statistical parlance, right? It comes from statistical hypothesis testing, but baked into that are your expectations and predictions based on some existing literature. And then last, we see this all the time now, right? Really saying like, stating your statement of intent as aims or goals, right? Our study goals were twofold. Our study goals were threefold, right? This study aims to do X. And so this is what Maggio did, right? So going back to that article that we've been looking at, clearly including a statement documenting the aim of the study. So this study aims to describe physicians' presentation of self on Twitter, now X, including the aspects of their personal and professional identities they choose to present. Here's another one, structured as a research question. Are medical students who experience success going through research and publication process more likely to stay involved in research and keep publishing after graduation? So again, make sure that is in there. That's going to be your anchor point for your peer reviewers. It's also going to be an anchor point for you as well, right? In terms of this is our question, this is our aim. Very often in the scholarship process, we get distracted by shiny things and we try to pursue them, not really kind of sticking to what one's clear question and intent is. Here's the last example I'll show you, where you can see all those components coming together, right? The problem, gap, hook, and statement of intent. This was a study that was about the experiences of left-handed medical students, right? So really kind of an interesting study here. Notice the language that's used here, right? Specifically the use of we know, we don't know. A very, very effective way to set up that problem and gap, making sure that your reader knows that you're informed, right? So again, this scholarly conversation metaphor that comes back to it, right? So sets up the problem gap just perfectly, right? We know that surgeons struggle to teach left-handed learners, just as we know there are fewer left-handed surgeons in practice compared to other medical specialties. However, we don't know what the subjective experiences of left-handed medical students are in surgery, right? So this is then followed directly, right, by the hook here and the statement of intent, right? To create interventions that improve the education of left-handed medical students, we must understand their experience, feelings, and needs. Our study aims to do the following, right? So really just kind of nice, tight consents, again, demonstrating its novelty and its relevant, really clearly answering that so what question. This tip, I know it may, some of these do have this commonsensical aspect to it, but this takes practice and intentionality to frame your work in a way that appears appropriately additive and substantive to the field, right? So again, going back to Cleland's definition, the second part of it, advancing practice and knowledge, right? So you have to make sure that you are helping to kind of push that further. Okay, tip 5. And we got 7, so we're getting there. I think I'll finish them all. So a challenge we often face, and this comes from work by Glenn Regier. So just, all my great ideas are just borrowed from someone else. So this comes from Glenn Regier. Challenges that we often face in scholarship is that our expectations tend to shape the data that we choose to collect, right? So we focus on finding evidence that supports what we already believe or what we want to believe. And so we end up missing out on deeper insights and contributions. And so it's kind of like confirmation bias, right, in action. So we don't spend enough time looking at our data to see what else is happening. And we end up missing out on learning really meaningful stuff. So in many ways, we become overly reliant on what Dr. Regier refers to as a decision-oriented model of education scholarship. So we're quick to jump to the question of, did it work? Did something work? Did this intervention work? Before asking ourselves, what do we think is happening here, right? If we look under the hood, why is this happening, right? And when we get a simple yes, we're satisfied and we move on. And the problem with that is that approach turns publications into more of a show and tell rather than a real contribution to help promote understanding in our community. So again, we focus on proving something instead of understanding something. And as Glenn Regier says, we learn more from examining our struggles and from proclaiming our successes. So to just distill it even further, right? There's always a better question than does it work or did it work? And there's always a better answer than yes. So as you're developing scholarship, you have to shift from that imperative of proof to the imperative of understanding. So don't just tell what you did and what you found. Tell us what you learned during the scholarship process, asking questions like what's happening here? What can be learned? Share the messy parts, right? That could probably be another tip I could add here. Share the messy parts so that others can gain insights into the complexities of your work. That's really where good scholarship lies. I want to just kind of relate it to all this. Just kind of, this is something I always think about when I'm mentoring others or thinking about my own kind of research. Is this work by David Cook, which really does emphasize the need of going further in our scholarship. And so, not surprisingly, educational literature, it's huge, right? It's massive, it's extensive. And we have meta-analyses that have shown us that if you teach medical students something, they almost always learn, right? So you put smart people in a room and learning happens, right? So that's not a surprise. We know this, right? And that's not meant to discourage you or others from publishing, disseminating scholarship that documents student learning, right? Because that's an important outcome. That's what we're all trying to do here. But I just want you to be aware of this common pitfall, which again is stopping at the question of, did it work, right? Go further, ask those meaningful questions. Why did it work? What made this approach effective? That's what's going to help us to, as Cleland says, to advance practice and knowledge. All right, tip 6, theory matters. So this is basically building off of what something Emily said early on. In the last 10 years or so, I don't know, maybe it's my own kind of impression, theory is at the forefront of medical education, right? It's more than just having its moment, right? It's the backbone that structures a lot of our research. It shapes how we teach. Theory has been so essential to scholarship that when it's missing, it's often a reason for rejection. Because of this, and because I know that many people, clinician educators, don't have a lot of exposure to theory in their training, I just want to spend a moment clarifying some terminology, giving you a reference or two to just to help inform you and think about its applicability. And so this is work that comes from some friends of mine, Steve Rugas and others in Measure, who actually did a big workshop on theory and published it. So this is all their work here. And so I just want to start by defining these terms, give you an overview, but there's a great reference, if you haven't seen it yet, by Lara Varpio and colleagues that explains all this stuff much better than I can, dives into how these terms are used in the research process in scholarships, but I'll try to break it down. So first we have, and the reason that I think it's important to explain these is that often they're used somewhat synonymously, but they're different, right? And this is this kind of jumble of words that can get a bit confusing. So first, conceptual framework. So Varpio and colleagues think about this as being the context, the big picture of the problem you're focusing on. So it sets the stage for what you're exploring, where the problem comes from, why it matters. So really similar kind of to that whole problem gap hook, right? And Rugas and others describe it as conceptual heritage, which is kind of a fun way to think about it. Next is theory, right? So theory, this is the abstract part. This is how we use, or this is what we use to describe relationships between concepts, or constructs to help make sense of the world or a particular phenomenon. I really like the analogy of it's a lens that we use to see the world, right? And we can kind of change that lens with different theories that we might put on, or we might kind of put on several, right, to kind of help us see the world differently. And then theoretical framework, this is how theory is applied to work. It's the set of connected concepts and ideas pulled from one theory or more theories that guide how you approach your work. So it's the operational side of theory, right? It's basically how it actually kind of comes to play in your work. Another way to think about it is that they ask different questions, right? So conceptual framework asks, where did this question and problem come from? And theory asks, how do aspects of my question and problem work? And then the framework is, what does my work look like based on the selected theory or theories? To make this less abstract, just want to consider the concepts using a clinical analogy, which may resonate with clinicians in the room here. So imagine you have a patient with this complaint that they are dizzy and they have periodic vomiting. And if we're going to think about a differential diagnosis, let's think about it from the perspective of 3 different physicians. So each of these physicians is likely to see the patient's problems through their own lens, right? And that lens is shaped by backgrounds and their specialty, the cases that they see, and lots of other things, right? So each physician may form an impression of the problem because their lenses are unique and different from one another, right? So a neurologist might say, hey, is this vertigo? And then we have an emergency med doc that says, is this a lesion of some sort? And then the primary care doc might say, maybe it's because of recent medication changes. And of course, there could be overlap too. Okay, pivoting slightly, right? So if we step away from the clinical metaphor, now let's think about a learning experience, right? Through the lens of different theories, right? So right here, we have 3 learners who are gathered around something, trying to make sense of it, and there's confusion. If we apply different theories to this scenario, each theory might see that learning experience differently. That's really highlighting different aspects based on their own perspective of how learning and other psychological processes occur and interact, right? So maybe we have something like organization culture theory that might think about relationships between learners and their environment that focuses on policies and systems that are in place that make learning possible. Maybe you have self-determination theory, meta theory of motivation, right? That might examine how can we structure small group learning to facilitate learners' intrinsic motivation to engage in the learning process. And then we have educational technology theory that might say basically that technology is critical to the learning process, right? So maybe it's something like using electronic medical records. Because of those different theories and different ways of seeing the learning experience, each theory will lend itself to different questions, right? Which will lead to different studies and scholarship. But again, they're all situated or based around a single learning experience. One last kind of sub tip here before I get to my last tip. I already mentioned the Goldilocks principle when it came to generalizability. It applies here as well. Using theory in education is about striking the right balance. If we get too caught up in theory, there's the risk of losing touch with what's happening in practice, right? It can become abstract and disconnected very easily. And I think that that's actually a big fault of a lot of education literature. And then on the flip side, though, if we focus only on the practical side, right, we're not grounded by any theoretical foundation, then we risk creating approaches, interventions, research that's not effective, not as efficient as it could be. So again, it's about finding that sweet spot where theory informs practice without overshadowing it. All right, last tip here. comes directly from the list of reasons that scholarship is rejected. And this is pretty much verbatim what Gary said at the outset. Ensure your methodology and methods are aligned with your statement of intent, whether that be your aims or your research question. Very often, there is a mismatch between the questions or aims of one's work and the methodology, which is a sure reason for rejection. And don't stop there, right? Also, make sure you provide that rationale for why this specific methodology, these methods, are the best choice among many other possibilities to address your question or aim, right? So that is often missed, this rationale. So going back to Maggio's article, right? Here's in their methods section. You can see they explain very briefly, but they do, why their methodology thematic analysis is a right fit for the study, right? Because of its alignment with our epistemology, right? This constructivist paradigm, because of its flexible nature and usefulness in facilitating identification, examination, and reporting of patterns, right? And then, of course, those methodologies, right, that we select, often because of those, they have inherent limitations as well, right? So that addresses one of the other reasons for rejections, which we saw earlier in the slides, right? Insufficient limitations need to be deliberately linked to methods, right? So a logical structure. And I'm happy to share a reference with you. I was going to discuss it, but we don't have the time to help us think a little bit about that alignment of methods with our question. That's all the tips I was able to cram in this small amount of time. I have more I could share. I'm sure you have others that you could share. I hope that you will consider these, or at least some of these, to help you develop more meaningful scholarship that, again, meets Cleland's definition, right? Work that's disseminated and work that contributes to advancing knowledge and practice. And then, of course, the bonus tip, right? So I'd be remiss if I didn't end with this note here, which is what we give advice to all medical students: read more, right? So read more, read more, read more. The references, there's plenty here. I'll make of these slides available to you all. I'm happy to answer questions you have, hear your thoughts or comments.
Very well done. Thank you. Questions, anybody?
Or even sharing experiences in the scholarship process, which you found.
I had a question.
Yeah.
I think something that I find maybe somewhat challenging in education scholarship is, I feel like a lot of journals, or at least maybe the ones I'm trying to submit to, are looking for Kirkpatrick levels 2 or 3 or higher. And so when you're in that initial exploratory, like, what is going on phase, I feel like it's hard to sometimes meet those higher levels. What has, I guess, your experience been with that, and what do you think about that?
Yeah, so you're absolutely right. Are we interested in whether students like things, right? Are we interested in confidence, right? Is that going to kind of entice journals to publish your paper? Absolutely not, right? Because, that's really 20 years ago, 15 years ago, maybe, right? That was kind of the heyday of show and tell projects. And yes, it's much more interesting now to have those higher level Kirkpatricks. And I love that you're even thinking about that, right? That you're bringing a framework to help think about learning, right? So that's great. You're already heads above other people. So this is when, again, it comes back to, okay, but this is when you have to make kind of compromises in some way, right? You might say, yeah, but our study is super novel, right? It's really like no one's doing this. This is really unique. And that may lend itself to an innovation article that does publish lower level Kirkpatrick, right? If it's something that's kind of, yeah, it's cool-ish, that's not, right? So you may have to kind of entice that by, I think as Emily had said early on, thinking about maybe if this is multi-institutional, right? We can see this happening in different contexts.
Mhm.
Sometimes it's just really knowing the literature more about and thinking a bit about what is the gap that we're trying to fill, right? And just simply just kind of adding another study that shows learning happens. That's going to be challenging to publish in a high-tiered education journal. What do you think, Gary?
Well, I was going to say there's, and I agree with you, Ashley. There's people get um, hung up on that. I think part of it is just when you're planning your project, thinking carefully about what you want the outcomes to be, because that oftentimes can help as far as what the intervention is going to look like and what you're going to be measuring as it comes out. I'm still, and I have told people this for years and years and years, that if it's a project worth doing, it's a project worth publishing. And a lot of times it's just a matter of finding the right journal home.
Mhm.
And I wouldn't get hung up on impact factor of journals
Yeah,
because more and more these days, it's more about how you promote it once it's published and getting readership because any one of us could get something into academic medicine or even the New England Journal and but big deal. Nobody's going to read. I mean, if nobody reads the article,
right,
at least if you are doing some self-promotion and putting it out there to say that you had something
right,
published, or ask your friends to promote it for you.
right. It's
Because I've had people do that as well. And, just because it drums up readership and that way you know that you're actually reaching people more.
yeah,
Yeah.
it's such a great point, right? And like there is absolutely nothing wrong with submitting these things to regional conferences, right? To have these conversations and which strike up collaborations and kind of extend that, right? So think about the GEA, right? And the regional GEAs. I don't know actually where you're located, but if it's, the Northeast, Southeast, but like those are incredible forums, accessible, um, high yield as well. So sometimes it's just what's the right fit, depending on so many different factors. And I think this is where mentorship can certainly help too, is kind of expectation setting and level setting too. It's a great question. It's just something that we're all struggling with.
Yeah, I mean, I think the struggle is not in showing necessarily like knowledge change or attitude changes, right? But sometimes going above that, um, if you want to show it, it would have to be like changes, maybe more sweeping changes in the curriculum or access to data that I don't have, right? Like if you want to show patient outcome changes, right, which is the ultimate goal of
Right.
any intervention.
It's, it's I see that Elise has her hand up too, but and it's also some of those higher yield outcomes, making that connection from a curricular change is really pretty. You got to be careful, right? Like
Yeah.
like changes that we see from these very high levels are likely to be multifactorial.
Mhm.
It's very unlikely to design studies that document some of these, right? Like we're not thinking like we're used to kind of a biomedical causal reactions, but
Mhm.
now we're in a complex social environment, right? That's so there's a
Yeah.
little bit of cynicism in that as well, right? That like, yes, our goal is up here, but we can't reach that, or we can't, our conclusions are tenuous at best anyways, right? So
Right.
yeah, Elise, what were you gonna say?
Oh, I was just gonna say, I think it's also pretty easy to get caught up in that the only form of scholarship is in the form of a manuscript.
Yeah.
And I think there's lots of ways and more every day to disseminate the work that you do. And so I always just encourage people to think like locally, we have a teaching academy and they have two poster sessions a year and two local meetings a year that you can present at. And then you think regionally, and there's the, GEA, and then there's your national organizations like for me, which is APCO, and
Yeah.
and there's abstracts and there's workshops and there's Twitter and
Yes,
some
yes.
people have done a lot with social media as ways to get some
It's
of their work out there.
and that's where you're so awesome points, and I really appreciate that. And I think that's where we could say, you know what, those Boyer categories, they're kind of don't reflect modern scholarship. Like you said, what are the tweetorials, right? Like this the whole notion of digital scholarship, right? Like how is
Huh?
is that kind of reflected? And um, those are conversations that are happening around that do advance practice, right? So you're
Mhm.
absolutely right. And we do get caught up in a very narrow way of scholarship, but thinking locally. I know that there's some institutions that even collaborated to say, you serve as peer reviewers of teaching. So it's external reviewers of teaching, right? And we'll do the same for you, right? And so you have peer reviewing of teaching that's being done by external people that kind of enhances the prestige of it, right? So there's many ways we can think about um, scholarship that aren't confined that. And I do recognize that even talking about education scholarship for the last 45 minutes, it's still kind of focused on the discovery piece. And I realize that.
So can I ask a kind of a follow-up question to that, though? So, I mean, I have a manuscript that's now been rejected, I think 5 times. There's a particular issue with it that I can't do anything about at this point. We've done posters, there's been an oral presentation, but the amount of work that has gone into the writing of it
Yeah.
is really hard to give up. So not that I'm saying those other forms aren't good. They are, and we went there and we submitted.
Yeah.
But what, I don't know if you just have any suggestions for that baby that you're holding on to, because it was so much time put into writing it up. And now what?
Yeah.
Don't give up.
So Emily,
Seriously.
yeah, so at least there are options, let's push away any predatorial journals, right? Like let's say not including the predatorial journals. There are some with a bit more kind of prestige peer reviewers that do have fees. That's an option. Jury's still out on how Mooney here feels about them, right? Um, so um, I like so as somebody who had so I have a manuscript. I'm planting my flag and saying this is worthy. I was rejected from academic medicine rhyme. I don't know if you hear when I was talking about that as a manuscript. Rejected a desk rejection from um, medical teacher, and then evaluation in health professions just rejected it. I'm in a similar spot. What do I do here? Like this has this like it's a small bite-sized piece, but what do we do at this point? Gary, I'm happy to finish that thought, but what do you say, Gary?
Well, I was going to say, I mean, this is one of those instances where it's a matter of finding the right journal for home for the article. You know, you've selected some, but maybe talk to the medical librarian to see if they have ideas about other journals that are out there, or you could use the journal author name um,
Done
estimate
that.
website, and but there are always a variety of journals out there. Some of them you may not think about. And it may be tweaking the article a little bit. And a perfect example of this is a systematic review I did with some colleagues in pediatrics. And we got rejected a couple of different times, and the lead author wanted to give up on it. And the rest of us are just like, oh, no, we're not doing that because we put too much work into this. Um, One of the editors that rejected it is recommended going to the Journal of the Medical Library Association, which who knew that existed? I didn't. But we went there, and all I did was tweak the methods as well as the limitations to point out that we did use the librarian, but the limitation was we didn't use them enough. And, and so just putting that spin on it got it accepted. And so we were able to get it published. So it's more a matter of finding the right journal. And, so it'll happen. A friend of mine had an article that got rejected 9 times and she finally got it accepted. So,
There is
no,
this persistence pays piece, right? I think other strategies, you're too close to it, maybe to make some of those tweaks. And so thinking about somebody who's external to it, who knows the game, right? Who knows the field well, that can provide substantive feedback. Hopefully the peer review process has helped to kind of think about the targets and some of that stuff you may not be able to control, right? I think there was a question that Ashley you raised Elise, who stepped off, said, "Do you use Jane?" And then Ashley said, "What is Jane?"
Oh, it's the journal author name estimator, and it's awesome. You can put in your abstract, your title, keywords, and it'll spit out journals that are potentially good
Oh,
fits for your work.
have I not known about this?
That will be tip number 8 for me, Emily. Yeah,
Yeah.
very cool. Yeah. Yeah, so Gary says drop an email.
It's not like Emily and I haven't worked on things together.
Yeah.
I'm
know,
very
so-
excited. I'm totally going to do that.
But
Thank you.
it's yeah, and maybe and you know what, like Emily, I hope that this becomes a basis for a talk for you at some point, that right about from conception to dissemination, like this is the life course of it. And this is the period of adolescence that was really hard, right? That it was rejected 5 times, but you got through it because of these reasons. Like I want to go to that talk.
Well, I mean, thank you to both of you, because honestly, your first part about finding an educational mentor in my institution, and in fact, in the 2 institutions I've worked at recently, I'm the education
Right.
person. And I am not an educational scholar. I'm not an educational researcher. I'm a practitioner. I can do faculty development I can
Yes.
run a workshop, man.
Right.
But I have a bajillion presentations, and there's a reason why I don't have as many publications. And finding when you're not at a junior level, when you're actually supposedly the person, like it's really hard to figure out, well, where do you go to for a consultation on methods, or where do you go for, Gary, thank you, like to run a sort of persistent issue past somebody to get a publication over the finish line.
Yeah, such a good point, right? These kind of, when you're an N of 1, when you don't fit the mold, right? Like I hear you. Yes, right? It's about this forum, right? Oh, cool. Gary's willing to, I'm willing to, others, or like, yeah.
Steve Rugas a couple of years ago put in for his Macy project to be like a consultation body for med-ed research. And I was like crossing my fingers that it would happen, because I need it. And I just thought it was kind of a genius idea for there to be a central repository where you could go get a consult from somebody, because we are spread so thin across medical education institutions.
Well, and I think in some ways that's where an organization like the Society of Directors of Research in Medical Education can actually fill a void. And since Dr. Mooney happens to be the current president of that organization, I think that it's an initiative that he can undertake.
No, but this is where it's right. I would say too, like, I don't know if we have, are you still at Brown, Emily?
No, so now I'm at UMass.
UMass, okay. I don't know if we have SDRME reps from those schools. Like maybe that's where it begins, and starting to build those, right? So but that's always an option too. And I'm happy to talk to you about that. Like what would it look like to develop a bit of a connection between your institution and a broader kind of group of individuals who might be able to help be those resources or point you to others, right? Like it's a great organization that I think is additive to many other great organizations that exist.
All right, I hate to do this, but
no, it's fine. We gotta go. See you guys.
Thank you all for joining. This has been great.
Thank you both.
All right, see you guys around. All right, bye.